Hi, everyone. My name is Rob, and I am a respiratory therapist, also known as a respiratory care practitioner. I work in a hospital, and I see people and treat patients who have difficulties with breathing because of asthma or bronchitis, people who have smoked for many years and have disorders such as emphysema, as well as take care of patients who have COVID 19. Especially this last year, it's been very heavy and taking care of a lot of patients who have COVID 19. We do everything from checking patients' oxygen levels to giving people medications to help open up or dilate their airways, such as when somebody has asthma or bronchitis. We teach people to breathe differently after they've had surgeries, especially lung surgeries because of diseases or disorders. I draw a lot of blood to check people's oxygen levels and their carbon dioxide levels. As simple as a lot of that seems, we do things as difficult as do a lot of CPR. I work in the emergency room, I work in the ICU, and I work on the medical surgical floors as well. And whenever there's a medical emergency and someone's heart is no longer beating, I will help do CPR to bring that person's heart back to a normal rhythm so that it's beating on its own again. I also help the doctors place patients on ventilators, also known as the life support machine. And I will deal with that patient and help that patient while they're on the ventilator to help get them off so that they're breathing on their own again. It can be difficult and some people get really sick, but that's what we're here for. I work in an acute care hospital, meaning the hospital that I work at, again, has an emergency room, different types of ICU or intensive care units, as well as medical surgical floors for people who've had surgeries or have illnesses or get sick with pneumonias. There's different types of facilities. There's a subacute, which is a long-term type of hospital where people who had difficulties breathing and are no longer breathing normally, and what will happen is the doctors and surgeon will place a tube in their airway, and they're breathing through a little tube in their neck called a tracheostomy tube. Some of these people will have to live on the ventilator, but we have facilities like that we work at as well. We have nursing homes and nursing facilities, and you can also work in the home care setting. I can see patients at home and help them with their oxygen or their oxygen machines at home. People have a machine that they can use at night to help them sleep called a CPAP. A lot of people have those. There's a lot to do, and there's plenty of variety of things you can do as a respiratory therapist. Respiratory requires a minimum of a 2-year degree in respiratory therapy. It's an Associate of Science degree in respiratory care. There is also a bachelor's program if you wish to further your education. Once you've graduated from respiratory school and you've completed your course successfully, you are then able to apply to your state for the state licensing board so that you can get your license for that state. Once you've passed your test for the state licensing board, you are free to go and work. Like myself, again, I work in the acute care setting. I've been in an acute hospital for 21 years. So lots of emergency room, lots of intensive care units, lots of surgeries, lots of emergencies, and lots of times where I go and just simply adjust a person's oxygen to make sure that they're either getting enough oxygen or I'm lowering it down because they're not requiring it as much anymore because they're getting better. It's a great job. It takes a lot of dedication, and you really have to want to help people and help them feel better. There is no lack of work. If I really wanted to and if I really needed the money, I could work 7 days a week. It's a great job, and I hope that whatever field you choose to go into, that it will be as rewarding as I find my career. But good luck to you all, and I hope that whatever you do meets what you need as an individual to be happy and be a good person. Take care.